Hello and welcome to the latest MM+M video. Today we're sitting down with AW, powered by Syneos Health. I'm Jameson Fleming, the editorial director here at MM+M and Campaign. And for today's conversation, we're talking about AI's impact on pharma brand building. And I'm pleased to be joined by Joe Daley, the president of AW. Welcome, Joe. How are you doing today?
I'm terrific, Jameson. Thank you very much. I appreciate the time.
Well, I'm
How are
excited to
you
get
today?
I'm great. It's a good
Good.
Monday. We're moving so far. I'm excited to have this conversation because I saw you at one of our events back in the fall, and I was so impressed and intrigued by everything AW is doing around the naming of pharma brand assets. And I know that's simplifying what you do, but at the core, I know that's a big part of the business. So I'm really intrigued to hear what you've got to say today.
Thank you. I appreciate that.
All
I'll try
right.
to
So
live up to that billing.
I'm sure you will. All right, let's get into it. So AI is making it easier than ever to create brand assets. So how do you believe it's making differentiation harder to do so?
I don't think it necessarily is making differentiating harder. It's more about anticipating, if you will, almost a new audience member, because AI is interpreting, AI is converging information about your brand. And AI is more or less taking those signals that are repeatable and playing them back. Most commonly, we see these days in search. Search historically used to be about retrieval. 2 years ago, you would put in a keyword and the search engine would return documents that contain those words and would retain or would send you links that were relevant or links that were responding to SEO signals. And then you would do the research and you would investigate, you'd read, you'd compare, and you'd make your own interpretations, if you will, remaining the human in the loop. So that's search is retrieval. Today, what we all know and have come to expect in such an unbelievably short period of time is search is an answer. You get answers back most of the time. And in fact, the data varies, but 60 to 80% of the time, this is a little bit alarming, 60 to 80% of the time, we don't click any further once we get those answers back. So when you talk about differentiation, it's more focusing on the discipline of brand design and the repeatability of your messages in the marketplace, such that when your brand is compressed in the fashion that I just described, what AI is answering is what you intended to answer.
Yeah,
That makes
and
sense? Is that like a
yeah,
little too wonky?
no, it makes sense. I do want to dive a little deeper into that term brand compression. I want you to explain more what you mean by that. And more specifically, where is that showing up in regards to pharma? Where should marketers be concerned?
Compression shows up in two primary places. The first one I just described, it shows up in search. I think we are used to at this point seeing the summary thoughts, the AI companion summaries. They come back when we do searches. That's a form of compression. AI is going out and summarizing your brand inputs and finding the things that are the most stable, repeatable signals and discarding everything else. And the same thing happens with large language models, ChatGPT, etc. The same pattern repeats itself. So that's how compression is incredibly relevant, really, to all brands and all industries, but certainly of relevance to us in pharma.
Got it. And when it comes to thinking about a brand from start to finish, brands traditionally have come to life at launch. Is that a model that's breaking down, or how is that changing overall?
It's not breaking down. It needs to advance further upstream. We tend to wait Wait's a bad word. We tend to schedule deeper brand design, deeper brand strategy work as assets get into late phase 2, early phase 3 work. It's when we get serious about positioning. It's when we get serious about really addressing and being specific with regard to audience needs that we're trying to meet and resolve. We're getting serious about our story and our narrative. We're getting serious about the character, how we show up, what it's like to interact with us as a brand. And it's not surprising because that work is costly work, and most companies don't want to invest those dollars until they're getting strong clinical signals. So if it's in late phase 2, early phase 3, you're feeling a little more confident at that stage. What I'm suggesting and what the environment is compelling us to do is to start doing this work earlier, literally late phase 1, early phase 2, because you want to control the narrative. It's that simple. You want to make sure that the company is aligned, all stakeholders inside the company are aligned, and that all external experience that you're creating around your brands is aligned to a simple brand blueprint with as little variability as is humanly possible. Because if you don't do it, I guess this is really the point. If you're not doing that, it really doesn't matter. AI will do it for you.
Yeah, that's a great point. And I mean, I was going to ask you, what else is getting decided beyond just a name that early, but I think you pretty much just answered that question. Or some more that you want to add to that?
I think it's the idea of just being more intentional earlier in development. Um, we have worked with many project teams at early stages because it's peculiar in the pharmaceutical space. We have to start the naming process in early phase 2, sometimes late phase 1, particularly when we're talking about creating the INNU standard generic name. So we're getting involved with project teams very early in an asset's clinical development. And we're talking about the creation or the invention of a name for the asset. And you kind of step back from that and you go, logically, that name is not brand and brand is not name, but name should be a loud, clear voice in telling a brand's story. So the more brand strategy you bring forward in the naming process, the higher probability you're going to end up with a name that is on strategy and in tune with the rest of the brand assets that you create, over time. As I said, positioning, purpose, story. Ideally, you want all of those assets working together in synchronicity, telling a single story. So with name, we get involved with that very early. And right now, with many of our clients, we're talking to them about, okay, we're not just fulfilling a regulatory path here. We're not just trying to mitigate risk to get a name approved. We're actually starting to build a brand. And that's more important than ever, given this new audience member. And that's really the way to think about it. We have a new audience member, and this audience member is AI. And they're very active, or this audience member is very active very early in your product's life cycle.
Yeah, and that all makes sense. And one of the things I know AW talks about is this idea that you're moving from insight to belief. So walk me through what the difference is between the two of those, and why does it matter ultimately for brand building?
Belief is a deeper, by definition, behavioral trait. Um, Beliefs drive behaviors, and beliefs tend to be rooted in purpose. Beliefs tend to be rooted in a deeper reason, um, for a brand, understanding why you exist in the world, why your brand matters to the world is a fundamental belief. It's not just an insight. Um, a purpose is something that is central. It's a North Star. It's a central truth. The best and most effective purpose definitions tend to be very compelling, very authentic, and very distinct. Brands are built on beliefs. Insights are critical in trying to connect brands to your target audience and to what your target audience believes and what's true about them. That's where insights become critical. Understanding those insights allows you to connect what's true about you as a brand to what's true about your target audience. Does that make sense?
Yeah, no, I think that's a really simple and easy way to digest what's pretty a big concept around, how you function, how you brand build. So I love that. And I do want to talk a little bit about data here, because at the end of the day, data fuels a lot of the decisions you're going to be making. Uh, so there's this idea that data leads to better decisions, but where does that fall short when it comes to brand?
When we're talking about the reality of AI compression, that's a dynamic that we need to deal with in the marketplace. It's a dynamic we need to be cognizant of. So, how do you leverage compression? How do you work it to your advantage? As opposed to being victimized by it, because you can be victimized by compression. The way you leverage compression to your advantage is by achieving coherence. Coherence. So, being very clear and very repeatable about what you stand for, and very clear and repeatable about the point you were talking about earlier, what makes you different, what you're resolving in the marketplace, and that you're very consistent in expressing those ideas. If you have not defined those crystallized thoughts, and instead you are um, generating significant amounts of data and putting significant data into the marketplace, AI will simply average, if you will, all that information and draw its own conclusions. So the point here about data is, while it's obviously extraordinarily valuable, the discipline with respect to how you frame your data to support a consistent brand blueprint in the marketplace is critical. Simply putting more information into the marketplace actually causes your brand to regress more to the mean, because that's what AI is doing. It's averaging your information. Is that
Yeah,
making sense to you at all?
yeah, I mean that's a great point, and it kind of leads me into my next question, which is AI is pretty well known for producing what's likely or expected. You've made a really strong case for why naming it should be an early stage task, but on the flip side, if it does become a late stage task for any number of reasons, what is the riskiest part of that mindset?
The riskiest part of it is actually, it sounds funny to say, but it's becoming indistinguishable. Indistinguishable. I can think of any number of phrases that we typically use in the pharmaceutical space, and we use them with a great deal of repetition. We're innovative, we're patient centric. You fill in the blank. There's a lot of additional phrases I'm sure you can think of. If you're waiting until late in the game, what that probably means is you're probably using language that is um, unapproachably genuine to the organization, but it's likely a little generic. And so that results in sameness. And AI takes that and essentially drives you to being indistinguishable. So you end up having to overcome that sameness. Sometimes you have to overcome and literally reposition if you're waiting too late in the game. The AI technology isn't waiting. That's really the point.
Yeah, no, I mean that's a great point to make, that AI is going to latch on to whatever it can and it's going to run with it.
Right.
Uh, on the flip side of that, you do the work early, brand gets it a little wrong, they get the positioning wrong, it's not working. How do you come back from that? What's at stake? And you just talked about repositioning. If you're waiting too late and having to reposition, what does that all look like if you come out the gate and it's not quite right? What is the work that needs to be done?
The identity emerges when the unnecessary falls away, is where I was trying to go. Is what you need to do is you need to figure out what the unnecessary is. um, because what you want to end up with is what's true and is coherent to you as a brand. So it's eliminating the inconsistencies. It's really interesting. If you and survey data will tell you this. If you go to manufacturers, let's say about their corporate brands, even they'll tell you like 95% of the time, they'll tell you that brand guidelines exist. And the company's done a great job and invested a great deal of resources to do all that disciplined work I just described to you. But the very next thing they'll add is that their confidence level is that only maybe 25 or 30% of the time do those guidelines actually get implemented with the same rigor and discipline with which they were built. That's a big problem. And we actually get engaged quite frequently at companies right now where their companies or their products, their assets have been branded, but they're having trouble with coherence. They're having trouble with the implementation and the discipline around making sure that the basics are repeated in all experiences at all times. Sounds simple, but it's not in practice.
Yeah, I can imagine. And my final question to you is I always like to leave people with a piece of advice if I can. Uh, AI is driving things so fast. The corporate world has put so much pressure on everybody to move faster, be better. So if you've got brand leaders out there navigating AI, facing all that pressure, maybe from executives who don't
Yes.
quite understand how it all works, but they're nonetheless,
Yes.
they've got that pressure on it. What's your best advice on how they should be navigating it?
Start earlier. Define your core, encode your signals intentionally, align the organization because branding should be the earliest competitive edge, the earliest competitive edge. It's not a phase 3 exercise.
That is a perfect way to end this, Joe. He's Joe Daley, the president of AW, which is powered by Syneos Health. I'm Jameson Fleming, the editorial director here at MM+M Campaign. Thank you so much for joining me here today, Joe.
You are welcome. It was a blast. Thank you, Jameson.